Hi, I'm Dr. Nixon with Healing Peak Regenerative Medicine, and today I want to talk to you about holistic care or holism. And the reason for that is because I often see a lot of patients who, just in our society, have been taught that we are separated into parts. And it's the language that we use around our bodies. It's the language that other physicians use to describe issues that are going on with us. Our legs are separated from our arms, our bodies and internal organs are separated from each other, our mind and our body is separated from each other in typical conventional medicine and medical model because we have specialists. And so those specialists really have only been focusing on that one thing that they know the most about or chose to study the most about, but then have a very limited idea of how that system may be affecting other systems and vice versa. And it's really important to understand this for pain management. And it's a widely mistreated population of people who are experiencing pain of many different kinds, whether it be joint pain or muscle pain or headaches or migraines or digestive pain, any kind of pain that someone's experiencing and seeking therapy for, which is one of the number one reasons people go in to see their doctor, typically is treated locally because of that one thing. And pain as a whole is very rarely a local only issue. And that's why I wanted to bring up this topic of conversation, because it's so important in understanding how your body works and how to get rid of your pain. And once you start to look at your body as an interconnected thing, it seems logical, right? But once you realize that what you eat affects your shoulder pain and what you eat affects your heel pain or your knee pain or how you sleep or what you sleep on or if you're sleeping or, the way that you're stressed out all affects your pain, right? When we're stressed, we start to go like this, right? And then you're going to get neck pain and shoulder pain. It might not just be your ergonomics at your desk. It might be the job and the ergonomics, right, at the desk. Or it may be that you're grinding your teeth at night because you're stressed. That is related to your mind, right? How your mind is functioning. And if you found a way to manage your stress and control your stress, you may not clench your teeth and then you may not have TMJ. And so all of these pieces need to be addressed when we are looking at someone's pain and their experience of their pain and how it is affecting their overall life, or how it's limiting them or inhibiting them from being healthier, like moving more, sleeping better, eating, making better choices when they eat. We typically, if we haven't slept well, are going to make poor choices. We're gonna go for the impulse versus actually having that checks and balances thought process. So there's a 1-2 thought process, and the 1 is your impulse and the 2 questions your impulse. And that questioning of impulses when you are not well rested does not happen, or it really does not happen as effectively. And so then you're going to impulsively choose poorer things or habits, right? To sit and watch TV for longer, or to pick ice cream for dinner instead of broccoli. And all of this goes and then kind of catapults you into an inflammatory living style, which then can increase pain and decrease all these other things. So it's kind of a vicious cycle. And it's not widely discussed. Hormonal issues can play a role in pain, and thyroid problems, which is a part of hormones, but most people think testosterone, estrogen, progesterone, and adrenal issues can be, a reason why you're not healing as well as you should. And so I just wanted to put this out there about holistic views of pain, and to start to encourage you to think about pain differently and think about things in your life or habits in your life that may be contributing to your overall experience of pain, or that may be making that pain response worse. And then starting to brainstorm little ways on how to change that. The book that I recommended last week, Atomic Habits, is a really great place to start. to kind of bring some awareness around those habits. And then also, if you're seeing doctors that you feel like are kind of separating you into your parts, but you feel like it's a whole body issue or they're just not putting all the pieces together, it's time to see a naturopathic doctor that specializes in pain. There are occasionally, and a lot of people have had trauma from previous sports or, knee pain because they played volleyball or they blew it out when they were younger or whatever. And then they have like a shoulder issue because they played a lot of sports, and that can certainly happen. Traumatic injury to a joint can weaken it and make it more vulnerable to injury over time. But if you're kind of experiencing just achy pain regularly in those joints and you're somebody who's like, oh, well, it's probably because I did this or probably because I did that, but it's in multiple areas of your body, it's very likely due to that previous injury, but also due to an underlying inflammatory response that's going on in there. And by reducing the overall load on the inflammatory response in the body, you can reduce or eliminate those pains from previous injuries that you had. And so that's what I mean, that pain is often not a local problem. And when it is, so let's say you're like, I do everything perfectly, like I sleep well, I eat right, I have really great relationships, I have a spiritual practice, I exercise, I have balanced exercise, I weight train, and I do cardio, like you are the prime perfect most of the time person, but you are still experiencing joint pain, that can be a local issue as long as it's not all over your body, right? And in that case, that can be healed with prolotherapy and platelet-rich plasma injections, which is what I do when the pain is not a systemic problem, which it more than often, at least a portion of it, is. And so that's what I do with my practice, is I educate people and I teach people how to take care of their bodies better so that they can live their lives limitless. And if there's still an inhibition somewhere, even after they have been educated and they know what they need to do for their bodies, then we inject it with regenerative injection therapy and it gets better and they go start doing things that they thought they would never do. And so there are so many varieties of alternative forms of pain care, even on top of just looking at your body holistically. And I wanted to bring some awareness around that because I really don't think that many people know about these things. And it's really important to get this message out there, especially after we were prescribing people opioids forever, right? Getting people addicted to these pain medications that they can never get off, that weren't really treating the pain. They were causing so many more internal issues. And then now since we're not prescribing opioids, I've seen an increase in gabapentin prescriptions and naproxen, which is a very strong anti-inflammatory, which destroys the digestive tract. Gabapentin comes with its other, unfortunate side effects, just of feeling drowsy, and some other things that I'm not going to go into in this video. But switching from opioids to non-addictive pain medications, is a step in the right direction, but we're still going to cause all these problems, which are then going to perpetuate more pain. And so if we could start educating people how to eat right, how to exercise, how to sleep, then, and how to take care of their bodies and their minds and not, get into a burnout situation, we will see pain decrease and activity increase in just a healthier overall American population. So if you know anyone that needs to hear this or that you think could benefit from learning about holistic pain management, I would love for you to share this video with them. Thanks so much, you guys. Have a really great day.